All right, well, it's 1:05. I know there might still be folks joining us, which is great, but I'll go ahead and get started in the interest of time. So thank you again so much, and good afternoon to everyone for being with us. Again, this is regarding the Ground Emergency Medical Transportation Private Provider Payment Program that's being operationalized finally. We're targeting the end of June to fully implement the program, which we'll talk more about that process and timeline here in a moment, but just excited to be able to connect with you all. We have a series of 3 informational webinars happening. The first was May 22nd. This is the second in the series today, June 5th, and then we'll have another one at the end of the month, June 30th. And so thank you again for being with us. We'll make sure that these recordings are saved and then shared and posted on the program's website as we will do with other materials for the program as well, other resources or documents or materials for the program. We have a few more that we're adding that are being worked on actively that I actually shared out in an email earlier today ahead of this meeting. So you could look for that email from OHA with the materials that we will talk about, some of the new materials that are being developed for this program, just to support you all, the providers, through the program, its operations, and so you can have that guidance and have that understanding of how it all works. So thank you again for being with us today, and we'll go ahead and get started. In the interest of time, we'll just ask anyone participating, OHA, providers, anyone that's participating today, if you can put your name and organization that you're here representing into the chat as far as our introductions. And again, my name is Michelle Mavison with Oregon Health Authority Medicaid Transportation Programs. I'm your main point of contact of all the OHA folks for this program. So if you're ever uncertain who to reach out to, you can always reach out to me if you're ever not sure. I'm typically going to be your point person, but if it's something that you would work directly on with Katie Brown, for example, for the current provider assessment process that's underway, then I'll direct you to Katie. So if it's something to do, for example, with the data reporting and provider assessment process, you could reach out directly to Katie. But if you're ever uncertain about who to reach out to, you can reach out to me and I'll either help you directly or connect you with the appropriate person at OHA. So again, Michelle Mavison, I know we have Rick on the line with us. I think we have Nathan as well from OHA. Sabrina, you've joined as well. I don't think we have any other opening remarks right now, so we'll just jump right into looking at what we'll be discussing. Last series, the first kickoff webinar that we had, spent a lot of more time talking about the background of this program, so we won't spend a lot of time on that today, but just to highlight the requirements and where we're at in the process to expand on a bit more. We were able to have Katie Brown with us last time on May 22nd. Don't think she's able to join us today, but we can still take in questions that you might have about the process with her or anything like that following this meeting. Feel free to reach out to me. I'll make sure that my information is in the chat and that anyone can reach out to me anytime, especially if you have something particular that you have a question about with the current process with Katie. We'll talk about the overall process for getting this program implemented. We already have some activity underway, like I was saying, that will highlight what exactly providers can do right now to be ready. One of the materials that got emailed out this morning is just kind of a one-pager checklist, just a reference document, really nothing that you need to submit to OHA, nothing official, but just to help see all the different eligibility requirements and requirements for providers to do, which I'll highlight and emphasize those today. and just seeing exactly where we're at in that process for the full automation that we need, the full completed system changes that we need still. So we'll talk more about that process. And then we will spend a bit of time talking about some things that are unique to the coordinated care end of this program versus the fee-for-service component. So we'll talk more about that. And then I've shared the recording from the May 22nd meeting. I also have a drafted frequently asked questions document that we can continue to build upon and expand on, and that will be made shareable and posted to the website as well, along with this recording and our third and final informational webinar series that's set up for June 30th. So following today's meeting, I'll let you all know as that gets posted and finalized for the FAQ document and the checklist. Those are not yet posted to the website. We also have an updated CCO contracting contacts list. So we'll talk more about that and make sure that following this meeting, as those get officially posted to the website, that you are aware of, notified when that's happening. And then next steps within the program, because definitely this is just the beginning. We will continue after June 30th to meet and have these check-ins available for you all as the program goes live and continually throughout the program. So this is just a short 3-part series for getting things kicked off for the program and hopefully helpful for you all, the providers out there, to feel ready for what's coming and what will be started, but we will continue to meet regularly beyond June as well. So thank you again all for coming. We won't spend time on these couple slides, but they're still there just to keep in mind where this program is established from. And we do have approvals, all the federal approvals needed. There is a fee-for-service component and a CCO component, like I said. A lot of the program operations apply to both, but there are a few differences in the requirements that we'll, again, highlight today to make sure everyone is aware of. So within the fee-for-service side of the program, that's being implemented going back April 1, 2023. That's a one-time approval through a state plan amendment, along with the House bill that establishes this program and the Oregon administrative rules as well that govern this. So that's the fee-for-service side. And then on the coordinated care side, we received approval through CMS via a preprint qualified directed payment model and process. So another part of CMS that approves for the CCO side of the something that we do need approval for each year. We did receive approval already for 2025 through the end of the calendar year, and then soon in September, one of our check-ins will really be focused on the next preprint submittal for 2026. So that involves a few different components and requirements within the CCO side of the program, and we'll spend some more time talking about that today. So again, your checklist reflects this, the FAQ that we're creating reflects this, just as far as what's required, what are the eligibility requirements for a provider that you're enrolled. Within the health plan, you have an active service license for the service transports that qualify for this program, which are advanced and basic life support, that your organization is not publicly owned or operated, not participating in the other GMT public programs, supplemental programs. You can't be participating in both, essentially. So if you are participating in an existing public GMT program, then that would be make you ineligible. But as far as everyone that's been invited to this series of webinars and that Katie Brown has reached out to directly from OHA to get processes started, you've all been identified as meeting the eligibility requirements. And then there's a few additional requirements on the CCO side. There is the additional requirement of having a contractual agreement, at least one with a CCO, and that's a federal requirement to be considered as a participating provider of the CCO. We have a fact sheet related to that that hopefully is helpful just to kind of highlight what that agreement needs to entail and how flexible it can be. And then we have the related other part of the requirement for the through the preprint submission and approval that we get each year with CMS includes a quality component to that, a quality measurement. And so in accordance, we must advance at least one of the goals and objectives in Oregon's quality strategy. So one of our upcoming check-ins, once we get this program fully operationalized and implemented here soon, one of our future check-ins will focus more on this quality measure. We'll take a look at the Oregon quality strategy together so you can see where this program is within those objectives and goals and how we're looking at progressing that. So I'll be excited. That's always a piece that I get excited about. So I'll be really happy to talk more in a future check-in about this. This is not a requirement that providers need to worry about right now. This is something that we will look to advance throughout the duration of the program. So that's something ongoing for the quality strategy and measurement. That is not something that you have an immediate deadline or due date for. It is included on the checklist document just to signify if you are a participant of the CARES registry or not. So we will have an email that goes out to you that explains to you what that is, what the CARES registry is, how it ties back to this program's quality measurement, and that you can let us know. There won't be a due date or anything associated with that, but just over the course of the next several months, we'll identify that with you. So it is included on the checklist, but it doesn't have a hard deadline, and it isn't one of the most immediate activities that are most pressing for us to engage on as we get the program started. But it is important and it is required, so we will continue to look at that and monitor and discuss that throughout the program's life. So again, just to talk more about the steps within the program, we have a couple checked off already where we've confirmed that you're eligible. Like I was highlighting those eligibility requirements on a previous slide. We've done that verification. We've notified you all. We've already had communications and engagements, and part of what's already been implemented and started with initial assessment, data assessment activity with Katie Brown and the CCO contracting component. So again, we'll talk more about those that are underway, but you can kind of see where we're at within this high-level process where those required documents are being submitted for the data assessment and the quality assurance fee collection, that those get submitted to OHA, and that does have a deadline by June 30th. We'll talk more about what that means and how to respond and what exactly to do between now and June 30th to ensure. And then additionally, the attestation of a contract, at least one, is the minimum to have in place with a CCO and submit that attestation to OHA. We don't seek a copy of the contract or anything like that. It's just an attestation form that you would complete and submit to OHA. And that also we made just consistent to be due at the end of June as part of this readiness for the program for when the system gets ready to accept payments and process the federal financial dollars to include and gets matched with the funds, the non-federal funds. And on the June 30th meeting, we'll really kind of dig into that a bit more for folks that are interested in exactly how that drawdown of federal dollars works and where the funds come and go through, and have just a more detailed look at that together. That I would think would be helpful, but just at a high level, where we're at now with the data assessment and the attestation as you connect with CCOs for this program. And then, yeah, we're looking forward to having those system changes completed as soon as possible. User acceptance testing is underway. We are moving closer and closer to that targeted date of June 30th for the system to be ready. And once that is ready, that's when the activity can start. And so we're anticipating that activity in the month of July, where then payments would be sent to the providers on the CCO end of things that's passed through CCOs. So on June 30th, we'll talk more about that detailed piece of it as well, since it's a bit different than direct, payment for fee for service, and how that depends on, these services that qualify for the program, which are advanced and basic life support. And it really pertains to which of those services, basic or advanced life support, were provided during the eligible period that's approved, right, during the effective dates for this program. And if that was given to folks on OHP under fee for service or a CCO enrolled member. So that's where that breakdown starts to happen, and we'll talk more about that detail at the next session as well. But there will be a final payment report that provides all the detail, what was submitted to OHA, what was processed with federal funds included, what the total is, what the breakdown amounts are, such as if it's by CCO, you would see the exact amount through each CCO being passed through that add up to that total amount. All of that will be in a detailed report that gets sent shortly after the activity occurs. For CCO, it falls on capitation cycles weekly and then a monthly bigger cycle, so that if we have the activity starting in July as anticipated and expected, then that report would come to you early August. And following any activity, you would always have that detailed report. We're also looking at ways that you can extract information and have detailed reports straight out of the system as well. So more to come on those type of details that we can leverage through the system, and what they call cold reports, quote unquote, but essentially the reports that providers could go into the portal of MMIS that they have and pull information, payment reporting information. So more to come on that potentiality as well.
Michelle,
and,
you have a question in the chat, just if you want to peek at that real quick.
Thank you so much. Spoke with James Flynn, said they only need a single CCO to meet the requirement. Yeah, so as far as the one, and we could jump to that and then talk about the other process underway with Katie. So to your question, Mark, and thank you so much for that question. So one of the things right now that providers can do is working with CCOs. We have a contact list for CCOs that providers can use. And really, like I said, this is stemming from a federal requirement that the provider be considered a participating provider of the CCO during the effective dates for the program. And it's at least one. It is a minimum of one. Potentially, that would be your most local CCO. But we know that emergencies with folks on OHP can happen anywhere at any time. So you might have some qualifying services where advanced or basic life support took place during the eligible period with a CCO besides your local CCO, where you might have the most of those services occur. And again, this payment program, it's supplemental, it's additional due to the high cost of these life-saving services. And so this has nothing to do with the base rate. You would still bill the CCO as usual for these services. It's just the system's going to look at when these services occurred and give you a supplemental payment, drawing down federal dollars included. It's on top of and separate from any reimbursement that you have with the CCO. So you would still bill as usual and all of that. But if you look at your billings from starting back as far as January 1st, 2024, because that's how far back the CCO component of the program is implemented. If you look at those services with procedure code A0429 or A0427, you can see hopefully within your claim detail when you submit the claim or bill through the CCO, just as normal business as you would normally do. But when you look at those activities, that will help you see which CCOs that occurred with, and those would be the CCOs you would want to have an agreement with. So having one minimally satisfies the federal requirement, but that only gives you that agreement in place with that particular CCO. If you had services that qualified during the eligible period with another CCO, you would also need a contract with that CCO. So I hope that explains the question. I know that was a really not the most concise way I could have explained it, but yeah, it is true that it's the minimum qualification of one. You could just submit one attestation to OHA for that having occurred, and that would minimally satisfy things from the federal requirement standpoint. But in practicality and in functionality of the program, it really depends on what services were provided to that CCO's enrolled member during the eligible period. And so if you have multiple CCOs where you've provided services to CCO enrolled members through multiple CCOs, you would want an account. The agreement would be flexible in type, but it essentially allows for that transfer from the CCO. So the way it flows, once we have the federal funds drawn down for this program, it gets passed through CCOs on capitation cycles to you, the provider. And so for that pass through from a CCO, you need that mechanism in place. You need an account with the CCO and agreement to just allow for that transfer. But it'll only be for the breakdown. Their piece of it will only be for what out of that total that was processed, what applied to their CCO enrolled members. So you could have Pacific Source with 25 services that qualified, and there'd be a payment portion there. And then you could have Trillium or another CCO where you had 5 more services that applied and a certain amount there that they would pass through. That total of the 30 transactions, the 30 services that applied, would still be rolled up into the total payment you're receiving, and that had federal funds applied to it, but it does get broken down for the pass-through that the CCO is only passing through the amount that applies to their CCO enrolled members that had services that qualified during that time period. So that's a really important note. I hope I didn't belabor it too much, but I know that that's a really important understanding to have. While the minimum requirement is 1, you do need something in place for the CCO to be able to pass through dollars. So we have that attestation form as well, posted on the site and available to use. You can submit those anytime. We ask that they come to the program inbox so we can track it most easily, but if any come to me, I'll forward it to our program's inbox. We'll make sure that it's tracked either way. If ever in doubt again on who to send what to at OHA, please reach out to me if you're ever in doubt of that, and I will get you to the right person, and we'll make sure we get it tracked, and we'll confirm receipt of those and make sure that we have that in place for you all. So minimum requirement of 1 of those. We do have an updated contact list as well that I shared out this morning that's not yet posted to the site. So I'll follow up to this meeting today to make sure everyone has that link once it's posted, but I did go ahead and give you an email attachment of it. So please take a look at that for updated contacts, and we'll continue to update that if any contacts or better contacts come about with the CCO for this program. And back to that fact sheet, this is something the CCOs are familiar with already from other existing qualified directed payment model programs. We have an existing GMT public provider program with all the same CCOs. So it is something that they should be familiar with. We've reached out and communicated to them about this program being implemented, so they know that this additional activity is coming. So hopefully you're not having a hard time, no barriers or challenges with connecting with the CCOs, but please do reach out if you have a contact that fails or anything like that. Let us know at OHA and we can help get you a better contact or a separate contact for the CCO as needed, so you can make those connections. And then, so that's one thing that folks can do right now, providers on this program can do right now, is working with the CCO, getting that in place, and then at least one attestation to OHA to send by June 30th. If you're having a problem with completing that attestation or anything, please still just respond to us within the month and we'll work with you. But we just need that response for the attestation and getting those completed and confirmed that we have those in place. And then the other part that's active right now is the implementation of the assessment with Katie Brown. So there was a February email, and then May 13th, Katie sent out the updated template, and that's with retroactivity going back through all of the calendar year 2024. That assessment and information is due to her by June 30th, but really what she asks is that folks reach out between now and the due date, even if it's to request a payment plan or something like that. Or definitely if you need assistance, if you have questions about the form or how to complete it or anything like that, please reach out directly to Katie. Reach out to me if you're unsure and I'll connect you with Katie. But Katie was stressing the importance for, as long as she hears from providers before the due date, if they're requesting a payment plan or something like that, that she will work with you all on that. We understand that, we're retroactively beginning in this program, and for all of calendar year 2024, that could be a big lift for some providers. Some might be readily able to move forward on that, but if you have questions about how to complete the form, or if you need to request a payment plan, please do reach out to Katie as soon as possible before the due date of June 30th. And I'll make sure that her information is directly available for everyone as well. Let me see if questions coming through. Can you clarify having changed existing agreements with CCO? Having to change existing agreements. So if you have an existing agreement with a CCO that you're trying to just incorporate this program, the supplemental payment program with, to allow for the pass-through payment for this program on the qualified directed payment model that is included, in the fact sheet, it highlights where within the CCO contract this is stated. And again, CCOs are accustomed to doing this for other existing GMT programs. I don't know, OHA is not a party to that. It's between the two direct parties as far as if this gets included into an existing agreement you have with them, or if it's a standalone agreement for the purpose of this program. It just needs to have the dates of service for whatever they're passing through the payment for. So if you had qualifying services between January 1st and June 30th, 2024, and the CCO gets that on capitation to pass through to the provider, to you, you would need an agreement in place with them for that time period. So if your agreement currently spans such as April 1st, 2024, but you had services that applied that the CCO would need to pass through to you that are applicable before that, you would need an agreement or to amend an agreement to include those eligible dates. So what we have approved for this program for the CCO side is going back as far back as January 1st, 2024. That's an annual submission and approval we have to get, and we have it right now for all of 2024 and all of 2025 calendar year. So right now you could have an agreement that spans as far back as January 1st, 2024, and could go as, through December 31st, 2025. It's okay if it doesn't span through the end of 2025, but it could. It just needs to span over the time period that the services occurred that qualify for the program. So, yeah, it would be advised to just look at those dates and make sure that if you had services that applied before then, that you reached out with that party that you have the agreement with and talk to them directly about that. But yeah, just to know that the CCO side of the program is approved as far back as January 1st, 2024. For the fee-for-service only portion, we have approval spanning back to April 1st, 2023. So that's April 1st, 2023 through the end, December 31st of 2023, and then including 24 and 2025. So that's ongoing approval for the fee-for-service side. It just spans a bit further back. So effective date, fee-for-service, April 1st, 2023. Effective date, CCO, January 1st, 2024. Fee-for-service doesn't need an attestation. That's a direct with the OHA situation, but the CCO component of the program, since there is that pass-through process that occurs with the CCO, and it gets approved through a preprint on a qualified directed payment model, then you do have to have some kind of agreement with the CCO to allow for that, and you do have an attestation due to OHA about that as well. So I hope that helps clarify. What advice would you have for us to understand backdating? So yeah, I would only say that I know that happened for the existing GMT public program. So I was part of that got implemented back in 2020, I believe it was, for its legislation and everything that passed back in 2026. So I was able to get that implemented, but there was some retroactivity right from the beginning. So I did really along the same lines as what's occurring now as far as connecting providers with CCO contacts, and had a very similar fact sheet produced for that as well. And that did go fine. We had providers and CCOs making those connections. The providers sent attestations to OHA. The CCOs and the providers have maintained those connections and expanded on quality through the quality measurement and care coordination together. So I can say that it was successful for the existing GMT public program, and a lot of the same contacts with the CCOs. So they were able to, between the two parties, the provider and the CCO, decide that it is a business decision between the two parties, but that did occur for a similar program with public providers not too long ago, where there was also retroactive dates involved. So I hope that might help. Let's see, there's a question coming through. But yeah, otherwise, I just wanted to highlight again that we have the new checklist that's been formed. We have the frequently asked questions that I would appreciate if everyone can take a look at. Hopefully, those are clear and inclusive and comprehensive of the questions that might be out there. We'll continue to add to that as well, and I don't have it finalized and posted on the website yet, but I will soon. I just didn't want to wait to share it out with you all. And all the questions that we have come up, and either with Katie and providers directly or through these forums or any of this, helps us continue to build that. And really, I'm thinking that that frequently asked questions document, as it continues to grow, potentially will help us design together just some program guidance documents that we could have, just so it's not so big to navigate within an FAQ. But the initial FAQ document hopefully is helpful, and I think that will lead us towards developing just further program guidance that you all can have to refer to as well. We have the updated contacting list with CCOs. We have the existing fact sheet, the existing data template, Excel template, and attestation template. And again, those are highlighted because that's really where providers can take action right now. Those templates are on the website and emailed out. So if you can definitely just make sure to respond to Katie between now and the 30th with her email from May 13th. And utilizing that data report and template and process, and then as well as the attestation piece to OHA to send by the end of the month for when you're making those connections with CCOs and getting an agreement in place. I did also want to just mention that we have some rulemaking going on for this program. I know we're almost at time. I wanted to leave just a moment at least to open it up with folks if you have just burning questions, but I promise that we will dedicate some time on June 30th to really just have a more open question and answer. But please, take a look at the FAQ that's been created, the checklist. Hopefully those might address some initial questions, and then we can see what, more detailed questions or further questions are left within the month as well. And anytime, please feel free to reach out. If you have a question, you can email me anytime as well. But I just wanted to highlight that we are having some rulemaking going on associated with this program. We had determined that an agreement with OHA would not be needed, that since you're going through the data assessment process with Katie Brown, and since you're already enrolled as a Medicaid provider, that we wouldn't need to do an additional agreement with OHA. So that right now had been, or that previously had been written into the rules that there would be an agreement needed with OHA and providers. And so we're doing some temporary rulemaking to remove that. And then we'll be going into a permanent rulemaking process here soon. So I'll send a separate email invite about this for anyone interested. We're going to start that community engagement. It'll include a rules advisory committee if anyone is interested. It's the direct program rules for this program, so I'm definitely going to make sure you all stay fully informed and have all those invites for however you want to engage, but there will be opportunities either joining the rules advisory committee that I form, or during public comment period, or during our regular check-ins together that we'll have during this process as well. This just got filed, so I just wanted to share it with you, but there will be a lot more to come throughout that rulemaking process for the next 6 months to make it permanent. But it's really just to clarify within the rule that we had determined with our Department of Justice and everything that what we have in place with you all is satisfactory, that we don't need an additional agreement between OHA and providers for this. So anyway, any questions? I know we're almost out of time. Appreciate everyone tuning in. And again, we'll make sure this is shared out and posted in a more timely manner than what occurred for May 22nd. But we'll make sure for any of your colleagues that weren't able to join today that you can share that out with them, and just really appreciate everyone's time and tuning in. Any questions, burning questions from anyone out there before we close out? Thanks, Sabrina. Thank you for being a great partner on all of this as well and advocating for your folks out there. You've been great to work with. Thanks so much, everyone. I'll stick on the line just if anyone else has anything, and otherwise I'll look forward to the next opportunity to get together. Thank you so much and have a great afternoon.